American Sunrise. I'm Dr. G. Thanks again for joining us this morning. We invite you to hop in our conversation on Getter and Rumble. It is time now to take the political pulse of America. Here's the beat today. Senate Republicans say they have finally rallied around a plan to take on expiring Obamacare subsidies, setting up a high-stakes showdown with Senate Democrats over dueling proposals. GOP leaders threw their support behind a proposal from Senators Bill Cassidy and Mike Crapo, a plan that would scrap enhanced premium subsidies and replace them with pre-funded health savings accounts. Oh, I love that term. But Senate Democrats are pushing their own proposal to extend the subsidies for 3 years, calling the GOP plan phony junk insurance. With a Thursday vote looming, both sides face math problems. They face standoffs and they face zero sign of compromise. Joining us now with reaction, Wisconsin Senator Ron Johnson. Senator, always great to have you with us. How do you expect these votes to go? Will there be resolution? Because, I mean, honestly, what the Senate is proposing sounds reasonable to me, Senate Republicans.
Well, good morning. Well, Republicans want to interject consumerism, free market competition to healthcare. Right now, every incentive in our healthcare system is for higher prices. Everybody's getting a cut. Nobody has an incentive for lowering any costs whatsoever. And so that's why we pay dramatically, more for healthcare than really any other developed country. Our problem is, and again, I come from manufacturing, solved a lot of problems. There's a process you have to go through. It starts with admitting you have a problem. And Democrats don't. I mean, they're just trying to mask the miserable failure of Obamacare. These premiums have skyrocketed. Again, different ways of calculating, but you go state by state. Premiums have increased by 169% since the implementation of Obamacare. Inflation's up 39%. That's 4.3 times the rate of inflation. And all Democrats want to do is keep throwing money, hundreds of billions of dollars, at that failed system rather than repair the damage done by Obamacare and transition to a system that actually puts consumers in the driver's seat, where you have price transparency because consumers demand it. And you do that by things like health savings account. You've already got catastrophic care plans. I mean, prior to Obamacare, that's what Obamacare plans were. The difference is they were dirt cheap. You had very high deductible plans, so people had to pay for, first dollar coverage of basic procedures, that type of thing. That's really the system we have to transition to. Our problem is a third-party payer system. Either government pays or insurance companies pay. Doctors, nurses, patients have no idea what anything costs. And so that's one of the reasons we have skyrocketing costs.
So, Senator, there's this other proposal out there as well that we want to get your take on. This so-called Marshall Plan, of course, your colleague there, Kansas Senator Roger Marshall, wants to extend Obamacare subsidies for just 1 year before then turning them into health savings accounts. I'm curious if you think this is a workable compromise, or if not, what would the solution be? What is your solution on this? What would you vote for and what you wouldn't vote for?
So we've got two problems, okay? The first problem is Obamacare is a complete failure. It's very difficult when you have Democrats not admitting that to work with them, get 60 votes, and pass something that actually fix it. The other problem is the short-term problem. It's more political. Democrats designed this. This is, Obamacare is theirs, the enhanced subsidies, that's what they did. They designed them to expire here at the end of the year. But because they're expiring, Democrats have done a pretty good job of scaring the American public into thinking that because Republicans refuse to extend those enhanced subsidies, that everybody's premium is going to skyrocket. If your premiums are going up, it's because of the faulty design of Obamacare. There's one group I'm sympathetic with. These are people making over 400% of poverty line, generally over 55. They were enticed, lured into early retirement during the pandemic based on the subsidies they're going to receive. Those subsidies go away. And because they're not eligible for Medicare and because of Obamacare, their premiums literally are in the $30,000 plus range. That government caused those premiums. Government gave them the subsidies, lured them in retirement. Now they're pulling them away. That's about 1.6 million people. It's not 340 million Americans. It's 1.6 million people. We can take care of them temporarily for a couple $1 billion, pay for it with real reforms. So I'd be willing to go down that route. I'm not willing to extend the basic subsidies because the people less than 400% poverty, they're still going to get subsidies. They just go back to Obamacare's original subsidies. So just let that happen.
So is that a standalone bill or a carve out or an addendum? How do you see that, the 1.6 million that you're talking about?
Well, I've got the concept scored by CBO. Score is still too high, so I think what I need to do is raise the percent we expect those people making over 4% of poverty line, what they should pay for insurance. So Obamacare is designed, if you're at the top end of that income, 400%, you're going to be expected to pay 9.5% of your income for your premiums before a subsidy kicks in. The score I got was for 10%. I'm thinking more 12 or 13%. Again, I think it's a reasonable thing to ask people making over 400% to pay at least 12, 13, maybe 14% of their income in health insurance premiums. Then we would kick in a subsidy after that. But again, it'd just be temporary to hopefully get Democrats then to work with us to repair the damage done by Obamacare, transition to a system that actually works. And again, that system would reintroduce consumerism, combination of HSAs, catastrophic care plans. That's not a dirty word. That's actually what insurance should be. Nobody buys first dollar coverage on car insurance, right? Again, you have to take a look at what would actually work. You have to recognize the reality of just basic human behavior. Nobody's also going to buy car insurance if you can buy it the moment you crash. So you've got to look at the reality situation, but Democrats simply are denying reality.
The reality is that you and your colleagues there in the Senate have a lot of work to do in terms of reforming healthcare in this country. In the meantime, there is going to be a hearing later on today. The Permanent Subcommittee on Investigation is set to meet this afternoon to identify fraud and other problems with our healthcare system. What steps are lawmakers going to take to address all of this, and what are you expecting to potentially come out of this hearing?
Look, I'm chair of that committee, so this is the second hearing. The first hearing was assessing the damage done by Obamacare. That's that first step, trying to get people to admit they have a problem. Unfortunately, at the end of that hearing, our ranking member said, I don't know anybody hired by Obamacare, even though his own witness, a mom from Madison, lost her coverage because of Obamacare, bought a $1,000 a month plan, couldn't afford it, had to switch to a lower tier plan, $14,000 deductible, had to take out a home equity line of credit to pay for $18,000 worth of bills. So his own witness was a victim of Obamacare. This hearing is about the second steps, properly define the problem and lay out the principles for the solution. Again, the basic principle is consumerism. I've heard it time and time again in hearings. Everybody realizes because people don't pay for things, they don't care what it costs. We have to transition to a system where patients pay more of their first dollar coverage, doctor's visits, different procedures, that type of thing, and insurance is designed for the major surgeries, that type of thing. Re-inject consumerism, free market competition, that will dramatically lower costs. Rick Scott had a great hearing in the aging committee. He brought in a surgeon from Oklahoma, set up a cash on the barrelhead surgery center, high quality. The rates were 10%. For surgeries that, in comparison to hospitals, 10%. That's the benefit of free market competition. You get lower costs, better quality, better levels of customer service. You see it Amazon competing with Walmart. You see it across our economy. The one area we don't have free market competition is healthcare. Interject in there and you'd be amazed at the results.
Senator, I'm wondering about what's deep inside of some of these bills. I want to know about things like infection rates that seem to be so well hidden from our public, but undoubtedly drive up costs and deaths. Two things that we need to change. I want to see things like price transparency addressed, where you get the bill, and if you're private paying, it's 1/10 or even less of a percentage of what is charged when an insurance company is paying, which ultimately does come out of all of our own pockets. I want to see things like expansion of coverage to more holistic, more boutique, more privatized style. Functional medical doctors, for example, often aren't covered. Why? Chiropractic isn't covered. Why? Physical therapy is sometimes not covered. Those sorts of things. I want to see a healthcare system that addresses the real needs of real people today, most of whom, I can tell you, Senator, in our chats say, I wouldn't go to a doctor or hospital. I would die first. A lot of people saying that today. A healthcare system is broken when?
So the solution to all of that is make people pay for healthcare out of their own pocket. Consumerism, you'd be amazed at the results. Again, insurance ought to be just like car insurance for the big things, not fixing the fender, not an oil change. So once you do that, you would be amazed at how medicine would flourish. You'd have all kinds of alternatives. You can go to chiropractic and you'd be paying out of a health savings account.
Right.
Okay. But again, the problem is the third-party payer system, we've transitioned to the point where patients only pay about 10% of all healthcare. Otherwise, it's the insurance company or government. You can pass a law saying you got to post prices, but as long as nobody's paying really responsible for that price, nobody cares. Again, it's just the insurance company and CMS bean counters that know what things cost. That's not consumerism. That's not the invisible hand of Adam Smith. Again, guaranteeing the lowest cost, highest quality, highest level of customer service. That's exactly what you're describing is what you want. You're only going to get that with consumerism. As long as you have a third-party payer system, you'll never obtain. You can't have enough government regulation and laws to force the kind of system that you were envisioning right there.
Can we get that? Can we get the consumerism that you're talking about without a full repeal of Obamacare? Can we just let it wither on the vine because we find a new way to do it?
Again, Obamacare covers through Medicaid expansion, I think something like 27 or 30, I can't remember the exact figure, but, tens of millions of people, not that many compared to 340 million. The exchanges are about 24 million, about 6 million are phantom. So you're talking about 30, 40, 50 million Americans on Obamacare. The rest of us have either Medicare, which is also government run, but then employer sponsored care. So if we can get government out of healthcare as much as possible, allow companies and their plans to offer different alternatives as opposed to the highly structured plans forced on them by government, drug formulas forced on us by Medicare. You've got to get government out of healthcare as much as possible, and then you have a flourishing in the marketplace.
Yeah.
Again, did anybody think that Amazon would really be able to deliver goods within 2 hours? It's just amazing what the free market does. We can have the same type of results in healthcare, but we're not going to do it with the third-party payer system, basically dominated by the oligarchs, which have every incentive of increasing prices because that's how they make more money. There's not an incentive in our current healthcare system to lower costs. It's just all incentives are to increase costs.
Senator Ron Johnson, thank you so much for being with us, and thanks for fighting for privatization for our economy. Thank you.
Thanks, Senator Johnson.
All right, coming up, it is time to spill some tea. There's more American Sunrise in just a moment.